Assalamu alaikum. I just would like to give an account about coronavirus disease epidemic. The incubation period of this disease is ranging from six days to 14 days, and the route of transmissions of this virus are three. The first one is the direct contact with bodily secretions. The second one is the airborne transmission, and also through droplet transmission. With regard to the symptoms and signs of this disease, these symptoms are unrecognizable from any flu-like illness. So it's simple upper respiratory tract infection symptoms and signs like rhinorrhea, coryzal symptoms, sneezing, coughing, and fever as well. With regard to the course of the disease, the course of the disease ranges from completely asymptomatic to the severe and fatal. And at the end of the first week and the beginning of the second week, from the onset of symptoms, the features of having secondary bacterial infection appear. So this is the point when we think of using antibiotics. Three major complications from this viral illness. The first one is the secondary bacterial infection, and the second one is the acute respiratory distress syndrome, and the third one is the sepsis or septic shock resulting from viremia or bacteremia. When to think on what is the time in which we think to escalate to the ICU, or the indications of admitting to the ICU. The first one is the respiratory rate more than 30. The patient saturation of oxygen becomes less than 92% while the patient is on oxygen mask with a breathing bag, like 10 or 15 liters per minute. When the patient shows a sign of hypotension or signs of organ failure. Important notes about how to confirm the diagnosis and when to decide to discharge the patient, to say that this patient is cleared from the coronavirus. The current kit used is the reverse transcriptase polymerase chain reaction, which is the PCR. Some people say the discharging criteria is to have 2 PCR negative 2 days apart, which is okay. And the other people say we need to have viral culture, which is negative, and we need to plus protective immunoglobulin as well should be in the board in order to say that this patient is free or clear from a coronavirus infection. Thank you very much.